Hi guys, my name's Sanjay Gupta. I'm a cardiologist in New York, and today I wanted to do a video on something called POTS syndrome. Okay, and now POTS is a very interesting condition. It's a condition that affects a lot of people, and especially a lot of young women. It causes a lot of distress. It can often cause a lot of disability. And unfortunately, because not many people, including doctors, have heard of it, it is often under or misdiagnosed. And many people are told that they're just anxious or that they're crazy. And a lot of these people who are genuinely suffering from a very disabling and troublesome condition are therefore left feeling deserted and let down because they think no one believes them and they're made to feel like they're just anxious or crazy. Okay, but I really do believe that POTS is a major problem. A lot of people are affected with it. And I have had great success with this, at least one of my patients who was really struggling with POTS. And I came across her, we met, and I didn't know very much about POTS, but through our interaction, we learned a lot from each other. And that has resulted in her regaining her quality of life back from being virtually disabled and not being able to get up and go anywhere. So let me just talk you through POTS. Okay, what is POTS? POTS stands for Postural Orthostatic Tachycardia Syndrome. All right, and so basically the hallmark of this condition is that the patient is okay when they're lying down, but when they stand up, they develop symptoms. Okay, so the symptoms occur in change in posture, and the symptoms can be so troublesome that eventually people become scared of standing up, and they become so scared of standing up that they prefer sitting in a wheelchair and being moved around in a wheelchair rather than actually standing up because the symptoms are so troublesome. And then they get into this vicious cycle because as they prefer to stay sitting, they lose muscle tone, and because they lose muscle tone in their legs, the situation propagates itself and they get into a horrible vicious cycle. All right. So now this is a condition that probably affects millions of people worldwide. Okay, because it's often underdiagnosed or misdiagnosed. It's very difficult to tell you how many people get it, but millions get it, and they're mainly female. And they're mainly between the ages of 13 to 50, but there is a spike around about puberty and also in sort of younger women, you know, so 20, 30 something women. And most of the times, these are completely normal people going about their business. And then one day they suddenly find that something's not right. They stand up, they find that their heart is racing, and that doesn't get better, and it continues to go on and continues to go on. And soon they become so scared of standing up, they become more and more disabled by this condition. So to try and understand this, to try and understand what this condition is, why it happens, we have to understand something called the autonomic nervous system, all right? Because a lot of places, if you look it up on the internet, they say that POTS is a dysautonomia. But for that, you have to understand what the autonomic nervous system is. And then you'll understand that POTS is a disturbance of the autonomic nervous system. So let's talk about what happens. For example, let's say if you're walking along in the middle of the night and someone jumps out at you, what happens? You get scared. You get this flight or fright response, don't you? Your heart rate goes up. Your heart starts pounding, your pupils dilate, your mouth goes dry, and so many other changes happen. Okay, and those changes are modulated by a part of your body called the sympathetic nervous system. The sympathetic nervous system is the part that is responsible for the flight or fright response, and it responds or secretes noradrenaline or adrenaline, okay, which are the flight or fright hormones. So we hear a lot about that. We hear a lot about that flight or fright response. What we don't realize is that the body has to have something to counteract those effects as well. Because, for example, if we are walking along in the middle of the night, someone jumps out at us, our heart rate shoots up, okay? But then it has to come back down, and we don't know why it comes back down. But the reason it actually comes back down is because of this thing called the parasympathetic system, which then acts to bring the heart rate down. So the heart rate shoots up. It doesn't just stay there forever. It then comes down. And the reason it comes down is all this adrenaline that is in there is slowly cleared away, all right? But actually, how much adrenaline is secreted is also controlled very finely by this parasympathetic system, which counteracts any overshoot. So if you're secreting too much adrenaline, then that signifies that there is a disturbance in your autonomic system, because the parasympathetic system is either not doing its job or the sympathetic system is doing too much. So dysautonomia, or a disturbance of the autonomic nervous system, is when this equilibrium between the parasympathetic nervous system and the sympathetic nervous system is disturbed. Too much parasympathetic activity, too much sympathetic activity, too much adrenaline, or too little parasympathetic activity to clear the adrenaline, too little activity to get rid of this adrenaline, is a form of dysautonomia. Now, let's talk about what actually happens to you when you're changing posture, because that is the fundamental to trying to understand why this thing happens, okay? So the big problem with us as human beings is that we have blood, and that blood needs to get to our brain, all right? Now, when we're lying flat, it's easy for the blood to get to the brain. The reason is because we're not acting against gravity. You know, when the heart is pumping, it's not pumping against gravity to pump blood into our brains. However, when you stand up, suddenly you have gravity pulling all our blood down to our legs. And ordinarily, if we didn't have certain systems in place, i.e. the autonomic nervous system, if we didn't have this system in place, we would all collapse. But we don't. We are able to stand up. So subtle things happen, and we're not always conscious of them. The first thing that happens is that as we stand up, the heart rate goes up, okay? The heart rate goes up. And the idea behind that is that the heart rate has to increase because there's some sympathetic activation. The sympathetic system detects that as we're changing posture, the heart rate, it pushes the heart rate up. It pushes the heart rate up slightly. It doesn't go up more than 30 beats per minute when you stand up normally, all right? And the idea is if the heart starts pumping more harder, you're going to keep more blood up to the brain, all right? But also another thing that happens when you stand up is that all the blood vessels in the legs squeeze, they squeeze, so they push the blood upwards. And therefore, by this way, they're preventing all the blood from sinking down to the bottom. Because if the blood sinks down to the bottom, the blood will drain out of the brain and you will black out. So the legs squeeze, the leg vessels squeeze, they stop the blood from coming down, the heart rate goes up, and therefore equilibrium starts being maintained. But once you then achieve that, then slowly the heart rate starts settling, all right, as time progresses. It's just really a compensatory mechanism for standing up, okay? But in POTS, what happens is the heart rate goes up excessively high. So instead of going up by less than 30 beats per minute, it can go up by 60 or 70 beats per minute. And the problem with that is that is very abnormal. That is not something that our bodies are used to. Suddenly the heart rate is going much faster. And the problem with that is that when your heart rate is going that fast, because the heart is beating much faster, it has less time to fill with blood. And because it has less time to fill with blood, you will actually get this feeling of less blood going around the body, all right? And so a lot of people, when they have POTS, what happens is the heart rate goes up excessively. The blood pressure doesn't fall, but because of this heart rate going up, the person will complain of palpitation. They'll be conscious that their heart is beating very fast. They'll feel lightheaded and they'll feel like they're going to faint, but they usually don't tend to faint, but it's sort of a pre-fainting sensation. They get discomfort across the chest and they get breathless. And these symptoms are not clearly understood, but I suspect it is partly because the heart is beating so much faster than you want it to, or than is normal, that you get some of these symptoms. Other things that people complain of when they change posture is they get a headache, they feel nauseous, they can feel tremulous, and a lot of people actually talk about feeling foggy in their brain, so they find it very difficult to concentrate, they feel muddled. Generally, they feel very tired all the time, they don't sleep very well, and their exercise capacity gets less and less. And as time progresses, because this continues and it becomes more and more disabling, then what happens is people start saying, well, I prefer to be sitting, I don't want to stand, because they don't stand, they don't walk, because they don't walk, the leg muscles which clench up don't clench up because you've lost tone in the leg muscles, and then that propagates the problem. And then what happens is these patients go to their GP or a doctor who may not necessarily have heard of this condition, and they think, oh, this sounds very much like anxiety. You're anxious, and they get put on antidepressants, etc. But actually, when studies have been done, people who have POTS are no more anxious than the general population. But for a lot of people, then they feel that they become more and more disabled, they become more reliant on medication, and they feel awful. And their quality of life really takes a knock. And a large part of their quality of life is affected, partly because of the depression and partly because of sleep disturbances that they get with this condition. All right, so that is what tends to happen. Now, the question is, why does it happen? Why do you get this disturbance between the between the sympathetic and the parasympathetic system? We don't really know yet. There are lots of different hypotheses, but for a lot of people that I've come across, it's been some kind of virus. So they've been fine, and then suddenly out of the blue, they get hit by some kind of virus, a chest infection or something like that. And then usually, if you are hit by a chest infection, you get a little bit of that. You get a little bit of dizziness when you're standing up, etc. But then it gets better as you get rid of the chest infection. But with POTS patients, what happens is that they get this and they don't get better, okay? And the diagnosis of POTS is actually made after a person has had symptoms continuously for about 6 months, okay? Because they say that, if you're just generally unwell, you'll get some of this anyway for a few days, but then it gets better. But with POTS, it doesn't get better, okay? And so what are the kind of hypotheses that have been postulated as to why this happens? Maybe we know that actually some people, they just have blood vessels in their legs which aren't very squeezy, which can't squeeze, okay? And because the blood vessels can't squeeze, the heart gets less blood than it's expected to, and so the heart has to work harder. So the heart is beating much faster to try and compensate for the lack of squeeziness of the blood vessels. We also know that people in POTS generally have less volume of blood in their body, okay? So they're carrying less volume, which means that they're more prone to the change in posture. If you've got less volume, then you've got less volume to keep up to the brain. So the heart has to work much harder to try and keep the blood up to the brain. Another thing we know is that some people have a hormonal problem. So when you are short of volume, when you are sort of volume depleted, we do have some hormones which serve to increase the amount of fluid we absorb from our urine, how much sodium our kidneys absorb, because sodium holds water. So when we are dehydrated or when we're short of volume, normally what happens is our kidneys detect it, it releases various hormones, and those hormones absorb more salt and water from our urine to try and maintain the circulating volume. But in POTS, what we also find is that there is a deficiency of some of these hormones. So that's another thing. Some people have something called mast cell, a flaky mast cells. So what that means is that, for example, when you get stung by a bee, the reason it gets all red and inflamed is because of this thing called mast cells. And what happens is when mast cells release what they contain, you get sympathetic activation. And in some people, they have flaky mast cells, so the mast cells spontaneously disintegrate, causing more sympathetic activation. More sympathetic activation means more noradrenaline. More noradrenaline means a much higher increase in heart rate, okay? The balance is upset between the sympathetic and the parasympathetic system. So those are the mechanisms by which this can happen. And then there's the treatment, okay? So the treatment is incredibly difficult. And the first thing I would say is that the most important thing of the treatment is not to lose hope, all right? So you mustn't lose hope, and you need to go and find a doctor who you have confidence in, and someone who knows about this condition, and someone who's patient enough to work with you and work in partnership with you to try and get you better, because it will take a long time, and it does need someone to be very patient and be able to reassure you and try different things. So it is crucial that you find a doctor that you have confidence in, all right? The second thing to say is that there are three main aims of treatment, all right? The first is you want to increase your blood volume, okay? Because POTS is a condition where your blood volume is less than it should be. So you need to increase your blood volume. Number two, you want to try and reduce this excessive rise in heart rate, because it's the excessive rise in heart rate which contributes to a lot of the symptoms. And the third thing is that you want to try and increase the squeeziness of your blood vessels, and the legs in particular, because they can help push the blood up to the brain and therefore reduce this sympathetic hyperactivity that occurs. So how do you increase blood volume? Number one, you want to definitely make a real effort to increase your fluid intake, really increase your fluid intake, okay? And increase your salt intake. Now, salt has had a very bad reputation. A lot of people say salt is bad for you, but in this condition, salt is very definitely good for you. There are things like something called fludrocortisone, which is which is a mineralocorticoid. It's like a steroid, which absorbs water, and you can take that as a tablet, and that will also improve things. When people have a very acute episode of a very fast heart rate, sometimes they end up coming into hospital, they get checked out, and they're told, yes, you've got a fast heart rate, but we haven't found anything. Actually, if they get given saline, just given a whole lot of fluid, saline fluid through their veins, then the heart rate settles with that. There is a tablet called desmopressin, which again just increases absorption of water from the urine, and that is also effective in increasing blood volume. Another aspect of increasing blood volume, apart from just increasing it, is to reduce losses, okay? So you don't want to lose blood volume, and therefore it's very important to avoid being dehydrated. It's very important to avoid diuretics. People who take caffeine is a diuretic. People who drink lots of carbonated drinks, they're a diuretic. And so you want to avoid all those things. You want to drink lots of water. You want to have lots of salt. You want to try the fludrocortisone, and you want to speak to your doctor about things like desmopressin, but you definitely want to avoid dehydration. You definitely want to avoid being in hot rooms, because wherever there's heat, there'll be more dehydration, particularly, hot showers, hot baths, that kind of thing. Okay, so that's the aspect around increasing your blood volume. So you need to work on that. And then there's a second aspect, which is reducing the heart rate, okay? And there are a variety of different agents which can help in reducing the heart rate. There's something called midodrine, beta blockers. Beta blockers are very good in reducing the heart rate, but what we want is, we don't want too much beta blocker. We just want to take the edge off the increase in heart rate when the patient stands up, and therefore very small doses of beta blockers work better than large doses of beta blockers. And then there is a really good agent, and the patient I've had success with really responded to this thing called ivabradine, which again slows the heart down. It doesn't have the same kind of side effects that the beta blockers are, because a lot of people who are on beta blockers find that they get tired, they feel, they feel more tired, they just don't like being on beta blockers. Ivabradine is generally better tolerated than beta blockers. And then there is something called pyridostigmine. So the opposite, with the autonomic nervous system, there's a sympathetic system, which is all about noradrenaline. Then there's the parasympathetic system, which is all about acetylcholine. And if you can increase the amount of acetylcholine in the body, then that counteracts this excessive noradrenaline, and therefore pyridostigmine allows more acetylcholine to stay in the system. All right. And then, and one of the most important aspects of all this is exercise. All right, because the biggest problem for a lot of people is they become scared of standing up. They become less mobile, they start losing the tone in their legs. And the tone in the legs is so, so important because it keeps, it's one of the compensatory mechanisms which allows blood to stay up in the body, stay near the brain. Now, if you lose tone, then of course, when you stand up, you've got the heart rate going excessively fast, and you don't have anything pushing the blood up because you've lost all this muscle tone in your legs, and that will propagate this problem. And therefore, exercise is really important. Now, most people will say to me, well, how do we exercise? Because we can't stand up. We struggle to stand up. Our heart rate already goes up, to 150 or 160 beats per minute as soon as we stand up. How do you expect us to exercise? And the answer is that you don't have to be upright to exercise. Try and do this kind of recumbent cycling or swimming or even a rowing machine stuff, so that you continue to maintain this tone in your legs. And a combination of those things, and also just working with your doctor, having confidence in yourself and not giving up hope, will result in significant improvements in your symptoms. Okay. As I say, this is not a hugely dangerous condition, but it is incredibly disabling, and particularly for people who are in the prime of their lives, young people who are otherwise doing really well, and suddenly they find that, oh gosh, what happened here? I had this virus, and a lot of people don't even remember having a virus or something, but overnight or their lives change. So what I would urge you to do is not lose hope. Find a doctor, and look it up on the internet, because there are some real hardcore world specialists around. One of them is in Newcastle. Find a doctor that you have confidence in, who knows your condition, who can then work with you about these things. But increase your blood volume, keep active, keep the exercises going. Even if you can't stand up, keep the recumbent exercises going, and take tablets to reduce the heart rate. And then work with that to try and get your muscle tone back. Okay, so I hope this was useful. I love receiving comments from you. I love the great feedback that you send me, and I'm very, very grateful for this. Now, I just wanted to show you, this is me, Dr. Sanjay Gupta. This is my website, yourcardiology.co.uk, and this is my Facebook page. So thank you so much, and I look forward to speaking to you soon. Bye.